I want to make a video about generalized anxiety disorder. I think I've only made one video about it. And in this video, we'll talk about the medication and a little bit about my issues. So, I was diagnosed with generalized anxiety disorder a long time ago. And I think I've recovered pretty well from it. I'm still unsure what it means to have generalized anxiety disorder. I don't really know. Like, all I know is that I was diagnosed with it. That's the first thing that they noticed. This is the first thing I was diagnosed with. So one of the medications I take is propranolol. Also known as Generalized. So before I used to take this medication twice a day for one day. Each day. Every day. So I take 2 medications per day. No, I take them twice a day. Every day, like, come on, like, imagine, like, all those I've taken 60, 90, I've taken a lot of these. So, and they affect your body. So, when I'm giving propranolol, I'm giving a review for if it's a good medication or if it's a bad medication. I give it a thumbs up. It's a good medication, it helps you, and I'm going to read its usages. This medication is a beta blocker used to treat high blood pressure, irregular beats, shaking, and other conditions. It is used after a heart attack to improve chances of survival. It is also used to prevent migraines, headaches, and chest pain, lowering high blood pressure, preventing chest pain after exercise, blah blah blah. Oh, this drug works by blocking the action of certain natural chemicals in your body, such as epinephrine, whatever, that affects the heart and the blood vessels. This effect reduces heart rate, blood pressure, and strain of the heart. Well, that's what I was prescribed this medication for. Since I have anxiety and I sweat a lot, my heart is fast. It helped reduce my heart rate. It helped me stop sweating. See, I would have been sweating right now if it wasn't for the medication. And now I take it once a day. I think I don't know if I mentioned that, but I take it once a day now. And I need to take it right now because I forgot. So yeah, I mean, it's pretty good. It's worked for me. It has reduced my stress. I haven't had any side effects. The only side effect I would say is dry mouth. Sometimes I get dry mouth. Other than that, like, it works for me. Like, it helped slow down my heart. It helped me not sweat. Like I said many times before, not sweat, because sweating was a big problem for me. And like, just my anxiety, like, it has, I don't know what anxiety means, but it has just gotten rid of it. Like, I don't feel that much anxiety anymore. The second medication, okay, now I'm talking about another medication, which is combined with propranolol. That's what my doctor told me, that these 2 medications go together with for the anxiety. The other medication is something called propranolol. So I don't know if you could see, but it should say propranolol. Propranolol. And yeah, I'm going to tell you its usages. This medication is used to treat certain mental and mood disorders. Example: schizophrenia, manic phase of bipolar disorder, schizoaffective disorder. This medicine helps you think more clearly, feel less nervous, and take part in everyday life. It can reduce aggressive behavior and the desire to hurt yourself / others. It may also help you to decrease hallucinations, example, hearing and seeing things that are not there. Propranolol is a psychotic medication, antipsychotic type, that works by helping to restore the balance of certain natural substances, example, dopamine, in the brain. I'm sorry, but I'm going to give this medication a thumbs down because it just says certain things that aren't true. Like that I felt the same after taking this medication, and like I said, this is for anxiety. So like if you had depression, like it wouldn't really help with that. So I mean, if you know what I mean, I'd say certain things that weren't did not help at all, did not help me with at all. But then again, it's the doctor told me that these two medications go together for anxiety. So I mean, I guess it did help, but just for anxiety, but not with certain things it says in the paper. So I mean, I give it a thumbs down. Like I don't even know what the fuck this medication does. I just take it because the doctor said like it's combined together with anxiety. Like that's how I know. So I'm not gonna stop taking it. Side effects. It did have side effects. Blurry vision. I know I made another video saying that Remeron caused me to have blurry vision, but I think it was this one that causes me to have blurry vision because if I look this way, everything seems blurry, and I feel like everything's moving. Like I just feel like it's going, yeah. So I think perpenicillin is the one that's causing me to have blurry vision because like when I read this, it's just like blurry. Everything's blurry. So that's one side effect. I'm gonna talk about propranolol. I'm going to say a quick story about propranolol. So if you take this medication, you're going to have to take it. You need to get a doctor's permission. Not a doctor's permission, but you need to ask your doctor before you get off it. I was taking propranolol, and then I had an issue with the medication, and it was an issue. So I said, "Fuck it, I'm not gonna take it anymore because I don't need it." So I stopped taking it, and I ended up having chest pain, and that sucked. Like you need to be careful when you don't take medications because I had chest pain, and I was scared as fuck. I was like, "What the fuck am I going to do? Where do I do? Where do I go? What do I do?" Like, and then like I was like, I was in line for something, and I didn't know anyone, and I didn't know how to ask for help. And it wasn't an anxiety attack. It was chest pain. Like, I don't know what the fuck it was. I know that it hurted my chest, like here. And then I was very scared because I didn't know what to do. And, yeah, like, I was like, fuck, like, I think I'm gonna have to call an ambulance. And I didn't want to call an ambulance. It took an hour for it to stop. Like, all of a sudden, like, after an hour, it stopped. And it's just an awful, like after that when I took, then like maybe a month later I started taking the medication again, and then I was like, okay, I'm not gonna stop, I'm not gonna take it. If I'm gonna take it, I need to, I mean, if I'm going to get off of it, I need to get off of it smartly and slowly. Like I need to cut the medication down to pieces so I could take it, and then for my body to get used to it. Because just getting off of it like that caused me to have like chest pain, and it was a scary situation. Because in all my videos I explain how much I hate hospitalization and how I'm never ever going to the hospital, and how just does how going to the hospital is a waste of time. Like they tell me like if I go to the hospital ever, I'm going to stay there for a week. Like, are you serious? I'm not gonna go to the hospital and stay there for a week. Like that's stupid. For a week, like imagine if I would have gone to the hospital that day, if I would have called the hospital, they would have been like, what medication are you taking? Like, oh, why you stop taking it? Like, oh, maybe this and that and that. Like, yeah, like you just, I don't want to deal with the hospital. Like, I've never been hospitalized. I've been to the emergency room once for like, I'm not gonna say for what, and that was like the worst experience of my life. It was anxiety kind of was involved, but like not at all. Like it was not involved. Like it had to do with something else. And yeah, like I've gotten better. Like this medication has helped, and just therapy has helped. Like even though I just hate therapy, like I know I just bash therapy, like it did help. Like therapy did help me with my anxiety, because before, like I remember one time I was going to the chicken store, the chicken store where they sell chicken hamburgers, chicken this and chicken that, and I was in the line, and I was like, and I haven't taken medication during this time, and I was like, hurry up. I was in line waiting. I was like, hurry up, like I want to go home. Like I want to go home. Like I want to be home. I don't want to be here. Like I just kept looking around. Just like I don't want to be around these people. I don't want to do anything. It's like I just want to go home. Like I don't want to buy the chicken anymore. Like I was like that. And now like I feel better. And like I remember I used to be embarrassed going to the cashier, and just I don't know, it was weird what happened like long time ago. I do still have anxiety. Like I do have thinking problems, but not as they aren't as worse as before. Because anxiety does cause you to have thinking problems. Like you're just, oh, anxiety, there we go. You worry about things like constantly, and I will worry about things constantly and constantly and constantly and constantly. And now I'm better. I don't worry about things more like I used to before, and it's like, because I will worry about things a lot. Not anymore. Okay, that's it. This video is so long. Goodbye.